Alright, people. We've got a patient here who's been displaying some pretty strange symptoms. First off, we've got pneumonitis, which is a lung infection. Then there's adenoitis and inflammation in the tonsils. And lastly, condensing osteitis, which is an abnormal bone condition.
Well, that doesn't really tell us much about their underlying illness, does it?
That's right, Leslie. We've got to think outside the box here.
Perhaps we should look into some rare conditions. Something that could explain all these symptoms at once.
I think I have my diagnosis. It's Dipigus.
Dipigus. What's that?
No way, Hawks. That doesn't make sense.
Come on. There has to be a more plausible explanation.
Listen up, folks. Sure, TMS, Dipigus, and Leslie, you're gonna have to perform an oophorectomy. It's risky, but I'm convinced it's the right treatment for our patient. I know the risks, Leslie, but I believe it's necessary.
And what about us, Hawks? You want Frank and me to break into the patient and chair, TMS residence?
Wait, I thought that practice was banned?
It's not banned, Leslie. It's just mildly illegal.
We'll be fine as long as we don't get caught. Besides, it might give us some clues on how they contracted this rare condition.
That's right. Now, let's get to work. I can't believe you're questioning my judgment again, Tracy. I've been performing these procedures for years, and I know what I'm doing.
And I have to remind you that in those years, you've also made your share of mistakes. Just because it's a rare condition doesn't mean we should take the risk.
I assure you, this is not just about my gut feeling, but scientific evidence. We can save her life with this procedure.
You might be right, Hawks, but then again, you've been wrong before. Let's consult with other medical experts and discuss this thoroughly.
The time for discussing is past, Tracy. The patient needs immediate attention. Trust my years of experience and then let me do what I know best.
I understand your concern, but as your boss, it's my responsibility to ensure the safety of every single patient under our care. But let's take a step back and reconsider.
Reconsider. We don't have time for that. The clock is ticking. I've made up my mind.
Then we'll have to agree to disagree, Hawks. But as your boss, the final decision is mine to make.
Oh God, you're repeating yourself. This conversation is boring. Be original or I'm gonna do something very original to my patient.
What the hell could be original for you?
I might get married.
Just as a one-time thing, which you know is usually original if only done once.
You're going to marry the patient?
Yes, that way I can convince them that you're a jealous ex who doesn't want them to live.
Oh, I really gotta see this. Are you gonna have Randall and Frank pick up an engagement ring from the patient's home in the meantime?
Shit.
Oh, damn it. I'm afraid it looks like oophorectomy wasn't quite the right treatment for our patient after all. Hey, the poor soul is in critical condition. I can't help but feel frustrated at this turn of events. Even the medical literature suggests that babies doesn't typically respond well to oophorectomy. It seems we've made a mistake here. Those two idiots better have found something helpful for this patient.
Nothing. Absolutely nothing. Classic waste of time.
Yeah, there's nothing here worth taking back to Hawks. Maybe some jewelry.
We're not here on a robbery mission, Frank. You've had experience doing these with Leslie, at least try acting professional. It's no wonder she got tired of going out on these assignments.
We could watch some TV in the meantime.
What's the worst that could happen if we spend a few more minutes out here?
You fucking idiots. You nearly killed her. How could you be so reckless? This was a misdiagnosis. It was the wrong treatment.
We found something in her home that might not have anything to do with Dipigus.
That doesn't mean it wasn't relevant, Frank. We should focus on what we can treat right now.
Alright, spit it out, Frank. What might not have anything to do with Dipigus?
It turns out the patient has a cable subscription, so we watched a few episodes of ghost hunting shows on the History Channel.
And?
Well, that was all. I was skeptical as to whether or not they found actual ghosts.
So fucking close to making you and Randall become guest stars on that show. You break into a patient's house and you give me absolutely nothing to work with. I'm operating on a brain cell deficiency. You jackasses.
So then, Hawks, what do you think the diagnosis actually is?
We'll never know. I'm getting lunch. Good luck saving this patient now. Frank, that's your last warning. How's it going in oncology, Johnson? I heard about your patients.
It's been tough, but we're making progress. A lot of them are responding to the new treatments.
That's great news. It's always satisfying when you can help people.
Yeah, it really is. There's no better feeling than knowing you're saving lives.
There's plenty of feelings better than that, Johnson. You just gotta think outside of the box.
Like what?
Like thinking outside of a box. When I'm in this godforsaken box saving lives like it's a routine, it's fun to think of what I'll be doing outside of it.
Oh, that's great. Okay, Hawks.
I've been thinking about this patient of mine. I believe I finally figured out what's wrong with him. It's a rare form of cancer. I'm pretty sure he has the Smithson variant. It's incredibly hard to diagnose.
You've got to tell me your methodology for figuring that out over lunch.
So you know how they serve us food here. They're in boxes. Smithson variant cancer is outside of the box.
Well, brilliant. Can't wait to hear you change your mind in the operating theater.
The theater is the great cousin of the box. But that's often a big box we like to think inside of, hence why there is no outside.
I don't even know what you're talking about anymore. In fact, I think I've lost my appetite.
And go throw up for all I care. I'm tired of wasting time. This is the moment we've all been waiting for.
Oh, great. Just what we need right now. A dramatic entrance by Hawks.
Seriously? Do you think it's appropriate to barge into an operating room without proper protection?
You know this isn't safe, don't you?
I've come here to correct the wrong done by Dippigus. He was mistaken, but I have found the truth.
Who the hell is Depigus?
Yeah, did he invent Smithson variant of cancer?
He invented boxes.
You know what? I'm starting to doubt you are qualified to be doctors if you don't even know who Dippigus is.
Sounds like the name of an ancient actor of the theater from Greece.
The diagnosis is nasodigoacoustic syndrome. And that, my friends, I solved during lunch with Dr. Johnson.
We're not friends. Anyway, nasodigoacoustic syndrome. What exactly is the prognosis for such a condition?
And why did I and Frank break into their home if you had the wrong diagnosis all along?
Well, that's what we're doing now, righting the wrongs. We need the whole picture. Next time, don't break into a patient's home and just watch TV if it's ultimately unhelpful. You're a real piece of work, you know that? Always gotta have the last word.
I haven't even said anything yet.
Oops, I must have read ahead. Sorry about that.
Where are you going?
Out of this box and into the bigger one, on my way to my box.
What the hell is it with you and boxes today, Hawks?
That's life's greatest mystery. What's in the box?
Hopefully, a better doctor than you.
Hopefully a husband you'll commit to for more than 3 minutes.